He's the Director of Infectious Diseases at South Shore Health to talk about COVID-19. Doc, we always appreciate the time. We know you're a busy man. We appreciate the time.
Hi, guys.
Today, the governor discussed how testing has expanded from 15,000 or so in a day this summer to 60,000 plus right now. But data shows 70% or more are repeats, like, for example, at colleges. So have we really expanded testing, and is this surveillance testing helpful?
Well, we've definitely expanded testing. I think it's very important. It is interesting that when you look at the percentage of tests that have been done, molecular tests, it looks like at least half the people have had at least 2 tests. So there are repeats, but we want that, especially as we're seeing Massachusetts creep up in percentage positive cases. We want to know who those negative patients are and the positive ones so we can isolate them.
And Doctor, we were just talking about this, the UK launching something called the COVID Challenge Trial, which is infecting healthy volunteers with a virus. You're a doctor, you're an expert. Tell us why they're doing this. What is your opinion, and does that cross an ethical line?
Maria, I'm really concerned about this right now. First, let me tell you 2 parts. First is the scientific validity. Before we even get to the ethics, we have to make sure it's scientifically valid. The issue is when you do these challenges where you immunize patients with the vaccine and then you give them virus, usually intranasally, you want to make sure that it's the population that's the most vulnerable, but you're going to test it in younger, pre-selected people who are very healthy. So are you even going to get the answers? You're probably not. That's the first case. The second is the ethics. When challenges are done, you're supposed to have treatments that can cure the disease or be really excellent. And I don't think we're there yet. We're getting better in hospitalized patients, but I worry about this right now.
It was a few months ago that the federal government told states to be prepared to distribute a vaccine on November 1st. Well, we're knocking on the door November 1st. It's now October 20th. And we keep seeing companies, for example, like Johnson & Johnson and Pfizer actually pause their trials or push back their timelines, which is not uncommon and not unrealistic. And they're certainly much a part of the real world. Are you confident that we will get an effective vaccine? And what's your estimate for that timeline?
These pauses should be reassuring and not alarming. It's saying that the companies and the investigators are putting safety first. So ultimately, when we have a vaccine and it is deemed effective, we can be confident that it's safe. So these pauses are very important. They're common, and it's really they're safety pauses.
That's good.
Important part of the process.
A great point.
No, it is a great point, and it's an interesting and a more positive way of looking at that. I read something yesterday. It said the next 6 or 7 weeks are going to be the darkest weeks that we've seen, which is, after doing all of this since March, it's just so disheartening. In your opinion, with your expertise, what's your idea of the outlook for COVID-19 between now and Christmas?
Michael Osterholm, who's one of the famous epidemiologists in our country, called it these next few weeks probably some of the darkest moments. I agree with him. Think about this. We are at a baseline where there's an average of 55,000 cases a day. We've reached as high as 70,000 just last Friday. And yet, winter isn't even here. We're going indoors. We know the virus transmits much more readily indoors. Thanksgiving's coming around. There's going to be more family gatherings. There's controversy about masking still, which there shouldn't be. We need to mask indoors. I'm really worried about this. I feel like there's a train coming at us in slow motion, and we have everything we need to get out of the way, but there's something that's keeping our feet in the tracks. I'm very concerned.
Dr. Ellerin, thank you for your time.
Thank you, Doctor. Be well.
Be well.